A great day to everyone, guys. So, today we are going to talk about anti-neoplastic agents and anti-inflammatory agents. But first, we will talk about anti-neoplastics. These are drugs that are used to treat different kinds of cancer. So, chemotherapy, that's what we call the treatment for patients with cancer, wherein we administer antineoplastic drugs or chemotherapeutic agents. So this involves the administration of cytotoxic medication. Cyto meaning cell, toxic, so it kills. These medications kill the cancer cells, and also chemicals to promote the death of tumor cells. So this is what chemotherapy is for. Aside from chemotherapy, there are also other two modes of treatment for cancer. We have surgery and radiation therapy. But since we are talking about pharma, we will talk more about chemotherapy. You are going to tackle more about the surgery and radiation therapy once you're already in your medical surgical nursing subject. So there are different routes of administration of antineoplastic agents. We have the IV route, the oral route, intrathecal. This route of administration is through the spinal canal. So the drug is injected into the subarachnoid space. Topical, so on the skin. Intra-arterial, so into the arteries of the patient. Intracavity, so it's administered or introduced into, let's say, for example, the abdominal cavity of the patient. And intravesical. If the patient has urinary bladder cancer, they are going to introduce chemotherapeutic drugs into the bladder of the patient. That is by doing intravesical. Now we talk about the cell cycle. In the cell cycle, it's most important for us to understand this in order to know the nature or the different natures of the antineoplastic agents. As we all well know, all the cells of the body, including the cancer cells, undergo the cell cycle. So we have the G1 phase, wherein the cellular contents, excluding the chromosomes, are duplicated. So all of the cellular organelles, if you can recall all of those organelles before, and each of those chromosomes, each of those 46 chromosomes are duplicated by the cell. So they're duplicated now. And the cell double checks. So that's in the S phase, wherein 46 chromosomes are duplicated by the cell. In the G2 phase, the cell double checks the duplicated chromosomes for any errors, making any needed repairs. And once that has happened, it will now undergo the different phases of mitosis until eventually cytokinesis occurs, wherein the cell splits into two daughter cells. So that's how the cell cycle occurs. It is also doing the same thing for the cancer cells. Now we go to the classification of the different types of chemotherapeutic agents. We now go first to the alkylating agents. These are non-phase specific, so meaning they do not interrupt any of the phases I have mentioned here, G1, S, G2, or the mitosis. They act non-specific and act by interfering with DNA replication. So they interfere with the DNA replication, the copying of the code of the DNA. Examples of this are cyclophosphamide, cytoxan, busulfan, myloran, and mechlorethamine, mustargen. So these are the alkylating agents. Next, letter B, anti-metabolites. They interfere with metabolites or the nucleic acids. Remember, the nucleic acids are necessary for the synthesis of RNA and DNA. So once these anti-metabolites interfere with the nucleic acids, of course, RNA and DNA synthesis is halted. Examples of this would be 5-fluorouracil, 5-FU, or methotrexate. So they inhibit or interfere the nucleic acids that is needed by the RNA and DNA. Next, we have the cytotoxic antibiotics. This one, they disrupt or inhibit DNA or RNA synthesis. So again, they stop the creation of new DNA and RNA. Examples of this would be bleomycin, blenoxane, and doxorubicin, adriamycin. And another would be hormones and hormone antagonists. This one, they are phase specific. They act on G1 specifically, and they act by interfering with RNA synthesis. We have diethylstilbestrol, DES, tamoxifen, which is the drug of choice for patients who have breast cancer. Nolvadex is the brand name, and prednisone can also be given. Prednisone is generally not, uh, uh, it's used for other things. It's an anti-inflammatory drug, but it can also be used under hormones or and hormone antagonists for chemotherapeutic agents. We also have the plant alkaloids. Vinca alkaloids are phase specific and they inhibit cell division. So they inhibit the mitosis phase of the cell cycle. So once they interfere with that, of course, the splitting of the cells into two daughter cells will not happen. So cytokinesis is not going to happen. Example would be etoposide. They act during all cell cycle phases, interfering with DNA and cell division, most specifically at the metaphase. Remember, at the metaphase, the description of our metaphase is where all the chromosomes are aligned at the center of the cell. So it helps cell division specifically at that phase of mitosis. Now, what are the different nursing implications in the administration of these chemotherapeutic agents? IV routes must be obtained by subclavian catheters or implanted ports or peripherally inserted catheters. So usually for IV, the subclavian or it is done by inserting subclavian catheters, and of course peripheral veins are the ones used in the administration of chemotherapeutic agents. And one of the major complications of chemotherapy, most specifically IV chemotherapy, would be extravasation. Extravasation. So extreme care must be used when administering vesicant agents. So in extravasation, the fluids from the IV is leaking into the skin tissue of the patient in the near the IV insertion site. So make sure that we monitor the IV insertion site every now and then for extravasation. If that happens, we need to reinsert the IV line. And warning, never test vein patency with chemotherapeutic agents. Do not do this. Do not test vein patency. Vein patency meaning you're checking if the IV is still flowing into the vein of the patient. You're going to do an IV bolus to check if the vein is still patient. Never ever do this because extravasation can occur. Remember, chemotherapeutic agents are vesicant agents. They are somehow concentrated agents, and they can cause this complication. So one thing that we need to do is monitor client closely for anaphylactic reactions or for any serious side effects. Discontinue the infusion according to protocol if reaction, any allergic reaction occurs. And use caution when preparing, administering, or disposing chemotherapeutic agents. Now, we go to the nursing management of the common side effects of chemotherapy. One is bone marrow suppression. Remember, the red bone marrow is responsible for the production of the different blood cells. Now, if this is suppressed, take note, the chemotherapeutic agents or antineoplastics do not only help the cell division of the cancer cells. Even the rapidly reproducing cells of the body are also affected. And what are they? One of them is the bone marrow, the other is our skin. So once the bone marrow is suppressed, leukopenia occurs. Leukopenia meaning there's very low or there's low white blood cell count. So if that happens, there is immunosuppression. The immune system is going to go down. So if the patient is suffering from this, we advise the patient to avoid crowds, avoid people with infections, and small children as well, since small children are easily infected when the white blood cell is or white blood cell count is low. Advise the patient to wear mask at all times as well when going out. And advise the patient to avoid undercooked meat and raw fruits and vegetables. Now, next we go to thrombocytopenia. So what happens here is that the thrombocytes or the thrombocyte count is lowered as well. So if the thrombocyte count is decreased, the patient will be prone to bleeding tendencies. So if the patient has thrombocytopenia, we are going to advise the patient to use electric razors instead when shaving. So I have that kind of electric razor. They are going to avoid um, razor blades because cuts can occur with them. If any of you males have been using razor blades, cuts are common with those kind of shavers. And avoid contact sports. Contact sports like boxing, football, basketball, anything that can cause trauma to the body of the patient because patients of thrombocytopenia can easily bruise. So if trauma occurs, apply ice and seek medical assistance. Avoid dental work as well or any other invasive procedure because of their bleeding tendencies. And avoid aspirin because aspirin contains an anticoagulant or any other aspirin containing products. The antineoplastics also have GI effects. It can cause anorexia, nausea and vomiting, and diarrhea. So, we educate our patients to eat small, frequent, low fat meals. Because if they eat meals or eat small meals but frequent, they will not be prone to nausea and vomiting. Avoid spicy and fatty foods as well because these kinds of foods can trigger nausea and vomiting to patients, even diarrhea as well. And avoid extremely hot foods or else it's going to complicate the patient's diarrhea. So, one thing that we need to do is to administer antiemetics prior to chemotherapy because chemotherapy really can trigger nausea and vomiting in the patient and the patient really will feel anorexia because anything that the patient is going to eat will just be vomited by the patient. So give antiemetics such as metoclopramide or Placil. Metoclopramide can be taken by the patient prior to chemotherapy in order for the patient not to vomit. And weigh the client routinely as well to check if there's weight loss brought about by anorexia. Stomatitis and mucositis. So, stomatitis, in the vernacular in Tagalog, it's known as singaw. This is common in patients who are having or taking in antineoplastics. Remember, the mucous membranes of the mouth, like the skin, is also one of the rapidly reproducing cells of the body. So this can occur, stomatitis and mucositis. So, client education for patients who are experiencing this, singaw, is to use a soft toothbrush. Mouth swabs may be needed during an acute episode because you know how painful that thing is if you have stomatitis or mucositis. Avoid mouthwashes containing alcohol as well, and do not use lemon glycerin swabs or dental floss because this can further worsen the pain brought about by these things. Consider using chlorhexidine mouthwash to decrease the risk of hemorrhage and protect gums for trauma as well. So chlorhexidine is more appropriate as mouthwash than those containing alcohol. For xerostomia, apply lubricating and moisturizing agents to protect the mucous membranes from trauma and infection. Xerostomia is the other word for dry mouth. So if the patient is experiencing dry mouth, just encourage the patient to drink a lot of water, or they can use artificial saliva or hard candies or mints for them to salivate. Avoid smoking as well and drinking alcohol, and drink cool liquids and avoid hot and irritating foods. Remember, there are certain foods that will irritate the stomatitis or mucositis of the patient. Even hot foods can irritate them. So drink cool liquids because cool liquids will soothe the pain from stomatitis and mucositis. Next, one of the common occurrences in antineoplastics would be alopecia, hair loss. Since the skin or the hair is part of the skin, since the skin is a rapidly reproducing cell of the body, tendency is alopecia to occur. So if the patient is a female, we are going to encourage the client to choose a wig before hair loss occurs. It's really not an issue for males to be bald. Maybe some, but not all. But for females, that can become an issue. So one of the more appropriate nursing diagnosis for patients experiencing alopecia brought about by anti-neoplastic therapy would be disturbed body image or body image disturbance rather. Body image disturbance. Always remember that. So care of the hair and scalp include washing hair 2 to 3 times a week with mild shampoo and pat hair dry. Do not rub the hair. Pat hair dry with a towel and avoid the use of a blow dryer. So that's it for the anti-neoplastic agents. Now we go to the anti-inflammatory agents, the NSAIDs. Now, the common NSAIDs that we have here would be aspirin, ibuprofen. They're very common. Most of these drugs are over the counter. Ibuprofen, naproxen, ketorolac, mefenamic acid, celecoxib, acetaminophen, and paracetamol. They are mostly over the counter drugs. And these drugs, they are both analgesics. All of them are analgesics, and some are analgesics and antipyretics such as aspirin, paracetamol, and ibuprofen. So they are used to treat pain and fever in patients who are also experiencing inflammation. Remember, in inflammation, remember the five signs of inflammation. You have rubor, which is redness, calor, which is heat, um, dolor, which is pain, tumor, which is swelling, and functionalize a loss of function for some cases, but not all the times. So those are the five cardinal signs of inflammation. Those are Latin: rubor, calor, dolor, tumor, and functionaliza. Rubor, like ruby, it's color red, redness. Calor, calorie, from calor, calorie, heat. Dolor, pain. So if you know someone named Dolores, pain, that means pain bringer. No, it's just a joke. But dolor is Latin for pain. You also have tumor. That's what tumor is all about. There's swelling and loss of function for functionaliza. So always remember those five cardinal signs. These are what the NSAIDs or the non-steroidal anti-inflammatory drugs are for, to reduce inflammation. Because one of them is making the patient feel uncomfortable, which is pain. So any of these can be given for pain. So, like what I've said, they're used to reduce pain and fever and eliminate fever. Aspirin has three properties. They are antipyretic, analgesic, and anticoagulants. That's why for patients who are suffering from dengue hemorrhagic fever, aspirin is contraindicated. It's contraindicated because it has anticoagulant properties. And remember, dengue hemorrhagic fever has bleeding signs. So we are not going to give this drug. Paracetamol is the drug of choice for fever for patients who are suffering from dengue hemorrhagic fever. Like what I've said, they are commonly over the counter. Now, additional information with regards to NSAIDs, like acetaminophen and paracetamol, if you're experiencing, let's say, for example, headache, you can take them. And in order to potentiate the function of these medications, in order for you to get relief immediately from headache, you can drink coffee together with these medications, except for aspirin and mefenamic acid, because coffee is already acidic, and if you mix them with aspirin or mefenamic acid, it can cause gastric irritation. So you will experience stomach aches. Aspirin together with the mefenamic acid, they should be given with food. They are given with food. And do not take them with coffee, or else you're going to experience stomach aches. So it's somehow, the aches is somehow related to hyperacidity. So if you're having headaches, one thing that you can do is to mix either paracetamol or acetaminophen together with coffee. Brewed coffee is best because it has higher content of caffeine. And caffeine will help increase the absorption of these drugs, the NSAIDs. So, like what I've mentioned before, some drugs such as paracetamol are already mixed with caffeine in them. The locally sold drugs, which is over the counter, like Saridon, contains both paracetamol and caffeine. So if you're not a coffee lover, you can take that instead. Based on my experience, headaches will disappear at around 15 minutes. 15 minutes. So that's how best coffee is with these NSAIDs. So if you have any questions about my lecture today about NSAIDs and anti-neoplastic agents, please do not hesitate to send me a message with regards to our lecture for today. Again, have a great day, everyone, and please read on our next topic, which is all about psychopharmacology or psych drugs, drugs that are used to treat psychiatric disorders. Again, thank you very much, class, and have a great day. Bye.